To discuss, we're joined now by the co-convenor of the Progressive Health Forum, Dr. Aslam Dasoo. Doctor, thank you for being with us. Should we be very euphoric and confident as a nation now? We've basically jettisoned the Astrazeneca vaccines that arrived earlier. We're going with these Johnson & Johnson shots. So we know now that these will work.
Hi, good evening. Good to be with you. I think there is great room for optimism at this point. We, as you've said, the Astrazeneca vaccine has been put on pause. It was to have been our primary vaccination rollout. And we were able to secure the Johnson & Johnson vaccine. And I think the day it arrives, and that's expected to be today, and when the first jab goes in, that'll be a red letter day for the country. It'll be the start of a great new phase in the management of the pandemic. And I think the country can take some heart in the fact that we are on the road as far as vaccination is concerned.
In terms of volume, though, this is pretty small. 80,000 Johnson & Johnson shots. More will come in later, but we have 1.25 million health workers. There's been no controversy around the decision, but do you think it is hard to decide who gets first and who doesn't?
Okay, I think it's important to understand why there was a pause on the Astrazeneca vaccine. Which would have resulted in a much greater rollout than we are going to have with the Johnson & Johnson vaccine, certainly in the next month or so. And that pause occurred through a fateful coincidence. When the vaccines arrived, the results of the trial demonstrated a lower efficacy of that vaccine against the variant in South Africa. The government was able to, with the assistance of the trial scientists on the Johnson & Johnson trial, secure 500,000 doses of the Johnson & Johnson vaccine. And so a substitution was instituted and fairly quickly because the doses were available. And now that we have them, we have to understand, unfortunately, that we can't get all 500,000 all in at once. And we're going to get them in batches of 80,000 per week or every second week. Until we've reached that first level. The other 9 million doses of Johnson & Johnson are on order and are expected at the end of March, beginning of April, I believe. And so that's a huge amount, and that will start being rolled out according to the program. Health workers, you're quite right, there's 1.25 million of them, will be the first to be vaccinated. This is logical, because vaccination is going to take a long time. With the arrival of the variant and this change in strategy, this recalibration, we can't be aiming now for herd immunity. Right now, we've got to try and stop severe disease, hospitalization, and death. All the vaccines work, including the Astrazeneca vaccine. The Johnson & Johnson vaccine has demonstrated a clear efficacy against the variant, as the minister said. And I think it's just logical that we proceed on that basis. And the really good part of this is that we're proceeding as planned. So there needs to be some, I think we've avoided a loss of confidence. The health worker cohort, if they do get vaccinated appropriately and in time, will be necessary to keep the health system stable. As you're aware, we are talking about the possibility of a third wave at the beginning of winter. And of course, when that happens, the health system goes under severe strain. Health workers get infected, some die, and the systems collapse. And we really need to avoid that. So I'm pleased that we are able to actually start. This first 80,000 will be distributed throughout the country to the various trial sites that are in place and ready to vaccinate. And again, let me just emphasize, the idea now is to stop severe disease from occurring.
In the meantime, Doctor, though, we have those AstraZeneca shots, and it's not clear in the research, but it could also protect against serious disease of our variant of COVID-19. So it wasn't shown to be effective in mild cases, but the WHO has even taken a stance that it probably will protect against serious disease. Are we not making a huge mistake then, getting rid of those, or the health minister saying today we'll try and sell them on to the AU or to other African countries?
Yes, there is a body of opinion, scientific opinion, and that's quite widespread, saying that, of course, the Astrazeneca vaccine is effective and will in all likelihood protect against severe disease. So the decision to pass the vaccine doses we have onto the AU has been a government decision. They're best placed to answer why they've done it. I do think, however, had we had the doses here and had we rolled it out to particularly high-risk groups, that would have been a completely logical and rational approach as well. Look, it is what it is now, and I think decisions have been made, and we may live to rue them, but I think again we need to just look forward now. Yeah. The country has been under severe stress. We do need to begin the vaccination program. Vaccine hesitancy is probably one of the biggest risks we face, and the confidence that can be generated by health workers starting to get vaccinated right now, I think is immeasurable. So, for whatever we have right now, we should proceed. The Astrazeneca vaccine, as you said, has been accepted to be effective worldwide. And worldwide, the dominant strain right now that we know is the original strain, or with variants that are completely susceptible to it. So the vaccines work. I think everybody needs to understand that. What we do need to do, however, as a country, is to try and prevent severe illness, prevent stress on the health system, and try and get to a position of population-level immunity at some point. That is not going to happen this year. I think people need to understand that. It may happen by next year, we'll see. But so we have to go back to first principles. The most important thing, nothing changes regarding the importance of your personal protective measures. We're all familiar with these, the mask wearing and the hand washing. And even if you do get vaccinated, it doesn't mean you cannot get sick. It does mean, though, that you are unlikely to get very seriously ill and need hospitalization.
All right, thank you for clarifying that. Yes, some concern, some criticism around South Africa not keeping that Astrazeneca vaccine stash that we have in hand, but we'll follow what the health department decides and where it'll go. Thank you very much. That was co-convenor of the Progressive Health Forum, Dr. Aslam Dasoo.